right, welcome back, everyone. The time is now 5 o'clock. As always, I'm Dr. Sean Hashmi, and today's topic, we're going to talk about something very interesting, which is your gut microbiome. So let me go ahead and hit live on everything here so we can go ahead and get started, and we are good. So, what are we talking about today? The gut microbiome is a very interesting part of our body because of the fact that if you look at organs in our body that are really important. We talk about brain health, we talk about kidney health, we talk about all sorts of metabolic diseases that go on. And underlying all of those conditions is the food we start to put in our body. And so people sometimes forget the idea of how important what you eat affects every part of our development. So this is an interesting topic today because the more you learn about this, the more you're going to be fascinating with the idea that what you eat truly can influence how you live your whole life. So with that, let's dive into gut microbiome and what are some key things you want to know about it. First is, it's like an entire civilization that lives in our guts. There's about 100 trillion different strains of bacteria that are living in our guts. 100 trillion strains of bacteria. That is an insane number. And then as we start to think about it, in those 100 trillion, about 70 to 90% of them, they actually come from a couple of different phyla, Firmicutes and Bacteroides. Now, the reason this matters is because as we talk about the good bacteria versus the bad bacteria, you'll start to learn how these things can be so important in terms of the overall structure. So let's get into a little bit. What happens when we start to eat? So essentially what happens is when you eat, the bacteria in your gut will start to break down the food into all sorts of molecules, and those molecules will interact with the lining of your gut. And it turns out that this lining is actually very small. And on this lining is all the rest of the bacteria that's there. So keep in mind that the bacteria that's there is going to affect so much of how the food you eat interacts with your body. So when we talk about some of this bacteria, sometimes what happens is there's these things about leaky gut. And what happens with this concept of leaky gut is you can have inflammation in the gut. And with that inflammation, you will start to get more and more bacteria go through your gut and into your bloodstream. And of course, as it goes into the blood, the challenge you have is that the bad bacteria can lead to all sorts of things. It can lead to things like irritation. It can lead to things like inflammation. So you can have all sorts of autoimmune conditions, lupus, rheumatoid arthritis. You can have chronic kidney disease. You can have depression, schizophrenia. A lot of these links that we are just starting to discover, it turns out that a lot of these things are really affected by the bacteria we eat. So, as we think about the different things that interact with our bodies, let's kind of break it down into a few things. First is this concept of prebiotics. Prebiotics gets the name gets used a lot. It's just a fancy way of saying fiber, right? So, prebiotics is what's going to feed the bacteria in your guts. So when we talk about probiotics, probiotics are essentially you're taking in bacteria. So if you're getting it over the counter, there's all sorts of brand names. That's probiotics, and probiotics are already in your gut. That's the bacteria. Then there is postbiotics. And postbiotics are incredibly important to understand because there's so much magic in postbiotics. And those are the metabolites coming from bacteria. So what are those metabolites? For example, short chain fatty acids, and we'll get into all these details. When we eat certain foods like fruits, like vegetables, even dairy products, all of those things, and of course, fermented foods also have a huge role. And spices like turmeric, all of those things will actually make a big impact on the type of bacterial colonization, so probiotics, that you will end up having. How so? When you start to eat more prebiotics, when you start to build healthy probiotics that are releasing short chain fatty acids, you will find that if we just talk about the brain for 1 second, you'll find things like brain derived neurotrophic factor is higher, and those can make you feel really good. There's more serotonin, there's more dopamine. These can affect your mood. So if you're going through depression, the foods you eat can actually make your depression better, or unfortunately, they can make your depression worse. In other words, if you're eating products that are high in processed foods, that are high in salt, sugar, and fat, those are not going to be as good as if you're eating lots of fruits, lots of vegetables, lots of whole grains, because those will help with the prebiotic component, having all that delicious fiber, feed the bacteria and lead to all sorts of wonderful changes in your body. So once again, this stuff, what we're talking about is as you start to think about these, all these things like GABA, like serotonin, like dopamine are all getting increased. And as these short chain fatty acids increase, it's not just mood. It also turns out that things like the decline in brain volume actually slows down. Even things like hippocampus. In terms of your hippocampal decline that we start to see with age is decreased the more short chain fatty acids you have. And when we talk about chronic diseases, dementia, Alzheimer's, where there can be all sorts of brain inflammation, the beauty of changing the bacteria, having more short chain fatty acids is you see a reduction in inflammation, you see a reduction in inflammatory markers like TNF alpha. You also start to see that there's all these other things that lead to inflammation, ACTH, cortisol levels go down. And all of those factors translate into what? Depression is better. Anxiety is better. Risk of schizophrenia, or God forbid, if you are suffering from schizophrenia, it's better. Even things like children who may have antisocial behavior or autistic behavior, instead of feeding them sugar, if you're giving them healthier foods, you can improve their behavior. How cool is that? That a simple thing like diet can have such an impact. And for those folks who are parents, or in other words, women who are pregnant, there's some very interesting study. There's a study in Molecular Metabolism 2024. The author is Lopez, Tello, and colleagues. And in this study, what they did was they were looking specifically at bacteria, Bifidobacterium breve, and they were putting it inside rats' guts when they were pregnant. So they had two arms. One arm where they essentially got rid of all the bacteria in the rat's gut who were pregnant, and the other arm they did. And what they were able to show was that when they compared the fetal brains of the baby rats that were born, what they would find is that the ones that got Bifidobacterium breve, they had a number of things. Their growth was better, their ability to perform on standardized tests that they give these mice, mazes, and so forth, they did better. So it turns out that all of those things make such a difference because what you feed matters. So let's start with the first idea, short chain fatty acids. So what are short chain fatty acids? When we eat prebiotics, or in other words, when we eat fiber, the bacteria inside our gut, it loves the fiber, eats on it, it ferments it, and it ends up forming postbiotics, which are the short chain fatty acids. So in terms of short chain fatty acids, you're looking at things like acetate, propionate, butyrate. I know these are big names and fancy names, but remember these names because we're going to talk about why these short chain fatty acids are so important. Because what ends up happening is these short chain fatty acids, as they start to go inside your body, they're going to start to bind to things like muscle, to liver, to your fat deposits. They're going to affect not just the secretion of gut hormones, but they affect appetite, they affect inflammation, they affect how much energy you burn, they affect how you burn fat. So when we talk about GLP-1s, if you've heard the previous episodes, we talked about Wegovy, we talked about Ozempic, and what I said was one of the mechanisms on how they work is they delay gastric emptying, or in other words, they slow down food from leaving your body. So, why do you care? Because if you take in fiber, fiber slows down food from leaving your stomach as well. So, I call fiber the poor man's Ozempic. I know it sounds terrible, but fiber really is awesome and it deserves a much higher place in your livelihood than any Ozempic or any Ozempic like product ever will. And by the way, I got to call out Mike's comment that pizza is the healthiest food on earth. So I wish that was the case because I can tell you growing up, pizza was very, very inexpensive. Not to go back to the old days, but I remember when for like $5 you could get like a gigantic pizza. And we were so broke that we would eat all of that food because it was really filling. And for $5 was a huge thing. We could feed the entire family. So it takes me back to those old pizza days, and I won't mention the store, but the store is still around. But yeah, it's crazy. Crazy how when you're suffering from financial issues and so forth, the foods we end up eating are always the foods that are absolutely terrible and unhealthy for you. Now, coming back to the SCFAs or short chain fatty acids, butyrate being one of the short chain fatty acids is very interesting because butyrate specifically will help to support your gut lining. It's very good at fighting bad gut bacteria. It helps to reduce inflammation. It's actually really important in preventing obesity. It's also important in preventing diabetes. And that's where the magic starts to happen. So, what's cool about butyrate, remember, it's a postbiotic, but it can also function as a prebiotic. So, it can feed the bacteria inside your gut. So not only does it get into the body as well and have all these functions, it can also serve to feed the bacteria. So it's actually very, very cool in what it can do. And what we find also is if you have a lot of butyrate that's being produced inside your colon, you will see that there's less likelihood of you getting hospitalized for any kind of infection, number one. Number two is there's actually a reduction in bone fractures. So, how that works, I have no idea because I couldn't find a mechanical explanation, but it's fascinating that your gut not only controls your brain, your kidney, your heart, your liver, every organ, but it also controls your bones. How cool is that? Now, what are some of the bad things you want to know about the gut microbiome? Well, depending on what foods you're eating, you can increase something called TMAO. And if you've been watching this channel, we've talked about TMAO, which stands for trimethylamine and oxide. And what's interesting about TMAO is it increases inside your gut depending on what kind of foods you normally eat. In other words, if you are somebody whose diet is predominantly animal proteins, not you're eating animal proteins, a couple times a week or whatever, we're saying that your diet is predominantly animal proteins. And that's why when you listen to this channel, what I talk about is the rule of 80-20. Try to be good on 80% of the time. If you can do that, you've already won the battle. Don't worry about perfection. Don't worry about 100%. Nobody cares if you ever hit 100. But if you could hit 80, you are way ahead of over 95% of the people out there. So when we talk about animal proteins, we're talking about things like eggs, milk, red meat, and of course, processed meat. So what these guys will do is they will convert the bacteria inside your gut. And, it doesn't take much, but the more the product you're eating has choline or L-carnitine, and your diet is predominantly a meat-based diet, then you'll get a whole lot of TMAO and you'll get a whole lot of phenylalanine getting converted into phenylacetylglutamine. And we're going to talk about why both of these become so important to understand. So there's a study in the American Heart Journal 2021, Tang and colleagues, and what they showed was that adults who went on to develop heart disease had significantly higher amounts of TMAO than those who didn't. And then mechanistically, there were studies in Cell that showed that when it comes to TMAO, it actually prevents cholesterol from your blood going into your liver and getting stored, and it increases cholesterol stored in your liver, ending up in your blood vessels where it'll hang around and start to deposit. So this becomes kind of crazy and kind of important to understand that your predominant diet, especially if it's a lot of processed foods and sugars and all this stuff and pizza and all those things, what you're doing is you're creating this highly inflammatory environment. Then you add meat on top of that, and that's where you get all the problems. So when people talk about meat as being absolutely terrible, the thing you have to understand from a science perspective, not a culture, religious, environmental perspective, those are different. As you know, I'm plant-based, but that's different than what I explained to you, which is what's the science, not my religious opinion or gospel around it, but what's the science? Science is if you start with an inflammatory environment and you eat red and processed meats or you eat really high sugar foods, now you got a recipe for problems. But if that's not the case and you're doing it, you'll find that then it's actually not that big of a deal. And what's interesting about TMAO is when they do studies and they start to control for things like how old you are, whether you're men, you're women, whether you're smoking, whether you have high blood pressure or high cholesterol, despite controlling for all of those variables, this idea of the fact that TMAO will be linked to things like heart disease is absolutely significant in there. The other part of this is that when you start to look at TMAO, what's interesting is TMAO, or trimethylamine N oxide, one more time, what it does is it actually affects your heart cells, the cardiomyocytes, directly. And what it does is it can actually make it so that the cells in your heart, they start to grow out of control. There's hypertrophy. They start to scar up, which is fibrosis. Their ability to generate energy and contract, which is what their mitochondria do, and their ability to signal, which is done through calcium, all gets messed up because of TMAO. And why TMAO? It's acting and forming inside because of your gut bacteria. And the gut bacteria is determined by what you eat on a regular basis. When you look at the other molecule, which is the phenylacetylglutamine we talked about, there's another study. This is also by Tang and colleagues, European Journal of Heart Failure in 2023. And what they showed was that there's a correlation between phenylacetylglutamine and cardiovascular event risk. In other words, your risk of heart attack in patients who have heart failure. And it turns out that the mechanism that's there is that basically phenylacetylglutamine is affecting the beta adrenergic receptors. Remember, we give all sorts of beta blockers to reduce your heart rate, to lower your blood pressure. Well, it's the same concept here, is that it's affecting that receptor. And as a result of it, it's making it so that your risk of having heart events, heart attack, or heart failure worse. So, taking a step back, if your diet is bad and you start to add a whole bunch of animal products, whether it's coming in the form of lots of proteins, dietary proteins, or it's coming in the form of lots of meats, whichever it is, you're doing supplements or so forth, what you end up finding is you're going to generate more phenylacetylglutamine and you're going to generate more trimethylamine N oxide. So phenylacetylglutamine is coming from phenylalanine. So the more phenylalanine foods you're eating, the more phenylacetylglutamine you're creating. Well, beans have phenylalanine. So why aren't beans considered bad? Because beans have so many secondary functions, because you're getting the prebiotics, you're getting the fiber. Whatever is the predominant population inside your gut, then you add something bad, you're forgiven. But if your predominant population inside your gut is bad, and then you add something bad to it, now you got a problem. So in other words, two wrongs are not going to make a right. Two wrongs are going to make a wrong. Now let's switch it around a little bit. let's talk about tryptophan. Once again, this is all about what's happening inside your gut, what's happening with the gut bacteria. So, what about tryptophan? Well, what happens is your microbes, your bacteria in your colon, they can convert tryptophan into all sorts of wonderful things. So remember, what happens with tryptophan is it actually is involved in the production of things like serotonin, melatonin. Why do you care? Because melatonin is really good for sleep. Why do you care about things like serotonin? Because it affects your mood. This is why, if you watch the video that I presented on almonds, why are almonds so cool? Because almonds are naturally rich in melatonin, they're naturally rich in tryptophan, and as a result, you're going to be able to sleep better if you're taking things like almonds. How cool is that? That something as basic as that, you can actually improve the quality of your sleep. Now, tryptophan has all sorts of metabolites. Other ones are like indole, tryptamine. There's another one, indole ethanol is another one. And what these guys do, these metabolites of tryptophan, what they'll end up doing is they will help to make your gut bacteria, instead of being leaky like this, they will change it. And what you'll find is that they will help the release of GLP-1. So everybody who's rushing on Ozempic, what they're forgetting is that if you want natural Ozempic, which is release your own body's GLP-1, all you got to do is focus on more fruits, vegetables, whole grains, right? If you start to do these things and you shift, once again, 80% of your diet towards more of a whole food, plant predominant diet, you're going to find that all these short chain acids are getting higher. You're going to find that you're generating more tryptophan. So, what are the tryptophan rich foods? Well, chicken is rich in tryptophan, eggs, cheese, fish, peanuts, pumpkin seeds, milk, turkey, and soy. That's just a small list of some of the names that are out there that you want to know. But the beauty of tryptophan is that tryptophan can be so important also in your overall mood, how you feel. So I hope you're starting to understand how your mood is controlled in a way by your gut, and your gut is controlled by the food you eat. So the next time you're going to a fast food restaurant, realize that you're going to feel crappy after you eat that stuff. You might have joy in that moment, but when you're done with it, you're going to feel crappy because of the fact that what you're doing is you're feeding all of the bad bacteria, the inflammatory bacteria, and that's going to come out of it. Now, what about other things? So, one more thing you want to know is bile acid byproducts. So, as you know, we end up releasing bile from the gallbladder, comes out, gets into the colon. It helps for you digestion of fatty products, right? People get their gallbladder removed. They have a hard time trying to eat foods that are rich in fat. But what is interesting is your gut. Also, the bacteria, the bugs in your gut, they love to feast on bile acids. And so what happens is bile acids can be very important in helping to shape the bacteria that ends up forming inside your gut. And it's interesting that these bile acids can actually convert certain hormones, like corticoid hormones, into things like progestins. Why do you care? Because this can actually affect things like postpartum depression in women who have just given birth. So there's a study, Cell 2024. This is from McCurry and colleagues. And what they showed was that human gut bacteria, and these names are extremely difficult to pronounce. So if I butcher it, for all of our hardcore scientists, you have my apologies ahead of time. But Gordonibacter and Egerthella, what they do is they convert all of these biliary corticoids into progestins. And the reason this happens or this matters is because of the fact that starting to have all of these excess progestins is going to make a difference on how you're feeling. So, as you start to think about all of this and you say, okay, I get it. What are the steps I got to take? It's very simple. Step number one is diversify your diet. There's this saying that you want to include the colors of the rainbow. What does that mean? Start to get a bunch of different types of fruits, especially berries. If you ask my wife, she'll tell you, I love, 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 love strawberries. That's my favorite. But diversify: blueberries, blackberries, raspberries, whatever your thing is. Add vegetables. What's your favorite kind of vegetables, right? Add nuts. I always have walnuts or almonds at my desk because whenever I have to munch on something, I try to munch on them all the time. And my wife is wonderful because we shop at Costco and I get a bag like that's enough to feed an entire village. Lasts me forever. But nuts, seeds, beans are absolutely amazing. Fermented foods. Remember kimchi, we've talked about it. Kombucha, we've talked about it. If you can do fermented foods, more power to you. And if you can't, don't worry about it. It's not like, oh my God, I'm going to die because I can't do fermented foods. Probiotics. Everybody's interested in probiotics. I don't recommend probiotics. And here's why. When the studies that I shared with you guys, this is probably a couple of years ago, that came out in Cell, what they showed was that when you take oral probiotics, 50% of the time they don't stick and they end up in stool. And so some of the studies that used to be done was they would measure the probiotics in stool and say, aha, you see, you took that probiotic capsule and now we're seeing more probiotics in the stool, therefore it must be working. No, because half of it just went straight through. The other half that would stick to the walls of your gut, sometimes it would crowd out the healthy bacteria from being able to stick there. So in other words, you were taking all of this diversity, right? We started the conversation by saying there were 100 trillion bacteria living in our guts. And you're taking all those strains and starting to make it so that the probiotic you took orally is crowding out the ability for your intestines to have diversity. If you have certain conditions, let's say you have C. diff colitis and your doctor gives you probiotics, that's for a very specific purpose. That's not because of this. And so as you start to think about these things, realize we are just on the cusp of starting to learn. One thing that I hadn't mentioned was that there's a study, this was in Circulation 2020 with Kay and colleagues, and what they showed was that short chain fatty acids like butyrate or acetate, what they do is they can actually lower your blood pressure. And so how cool is that? That if you're doing a plant-based diet, you're feeding the bacteria in your gut, and that can help your brain health, can also help your heart health, your kidney health, autoimmune conditions, and it can also improve simple things like blood pressure. How cool is that? And then there are certain studies they've done where they've actually created things like acetate and butyrate, and they've created these essentially products that you can buy that have short chain fatty acids. Now, I don't know if they're commercially available. I haven't gone on Amazon, but sometimes stuff on Amazon isn't legit, so just be careful. But essentially, they've created fermentable fibers of acetoacetate, butyrate, and what they've found is that when they've given patients these supplements, they've seen a reduction in their blood pressure by about 6 points. 6 points is a very big deal. That's about the same as taking a blood pressure medication, except you're doing it with food. So you have the bottom line, which is very, very simple, but I needed to explain to you why the gut microbiome is so important, so you'll listen to the bottom line. Sometimes people are like, well, the bottom line is eat more plants. I get it, but if you don't understand the why and you only focused on the what, then it changes everything. All right, now let me go and answer all of your questions. So let me take a look at all of the chat and see what you guys got. And Crafty Yes said, hi, Dr. Hashmi, sending blessings. Thank you so much. Times have been tough, so I can always use the blessings, and it's always tough. We're all fighting our own health. We're all fighting our own inner demons. And so thank you so much for the blessings. I appreciate that. And then let's see. Honey said, what would you do if when you okay So he said yes. Okay, so I don't quite understand, honey. I apologize, but you can ask the question again. Crafty has said, would drinking apple cider vinegar in warm water help to detox the bacteria at night? So the answer is, the data on apple cider vinegar isn't as good as people think. So, in other words, a lot of people get obsessed over apple cider vinegar, but in terms of studies, there isn't a whole lot of quality studies to either support it, because everybody thinks it can fix just about everything, and we don't know. Melody said, hello. Hi, Melody. Deet Dutton said, already whole food plant-based diet for CKD3. Anything special info about moderate use of MCT oils? So as you guys know, they can't figure it out. They think it's either very severe or complex migraines versus seizures. And that's my own health issue that I deal with on a daily basis. And I do use MCT oil. So in terms of MCT oil, the biggest thing there is you have to go very, very slowly, because it's absolutely going to mess up your gut, especially in the beginning. And for folks like myself who are suffering from seizures slash migraines, it actually takes a pretty higher dose of MCT oil. And the reason they use MCT, or medium chain triglycerides, in kids is because with kids, it's very hard for them to get rid of all of the carbs. So MCT oil allows you to be able to increase carbs. So that's the biggest thing, is the GI part, because if you're having nausea, vomiting, or diarrhea, that can affect the absorption of your medication. So just please be very, very careful as far as that goes. Let's see. Aloha Kitty said hello from California. Carolyn said, can too much vitamin D be a problem for kidneys? 100% yes, because vitamin D will cause increased absorption of calcium. And we've had patients who've gone into acute kidney injury because of calcium overdose. So the answer to that is high amounts of calcium can high amounts of vitamin D, which can lead to high amounts of calcium, can be a problem. And that's why for most of our patients, if a patient has bariatric surgery, then we have them take 5,000 international units of vitamin D per day. Otherwise, for everybody else, 1,000 to 2,000 is a very good number in terms of that. But just about everybody I know ends up needing vitamin D. So, we can't really go in the sun with all sorts of things about skin cancer, aging, and so forth. So it's not a bad idea to consider it, but always make sure that you're not overdoing it for no reason. And if you're going to do vitamin D, I take mine with K2, and you can see the videos on D plus K2 and what's the benefit as far as that goes. Crafty has said, if it's made with homemade pita and good wholesome ingredients on top, yep, it's good. Yeah, so remember, once again, the concept is if you're starting to get whole foods in your diet, you're going to do fantastic. Feed the gut whole foods, and you're going to find that the gut bacteria will translate into better sleep, into lower risk of dementia, Alzheimer's, autoimmune conditions, and of course, all of the conditions, including kidney disease. And that's why we talk about it. And Bharat said, and those days are gone, to my joke about, those food prices where you could feed a family for $5. Yeah, those days are absolutely gone. And then Crafty has said, grow your own vegetables. Exactly. I mean, you can do that if you like. When we were living in a house, we used to do that. We're in an apartment now, we don't. But my favorite is farmers market. Please go out, support your local farmers market. It's a wonderful, wonderful thing to be able to do. Doma asked the question of, can IgA nephropathy patients eat vitamin C? That's tricky, because remember, vitamin C can convert to oxalate. So we worry about that as far as that goes. So, there's a limit to what you can do, but it really depends on what your GFR is, what your kidney function is like. So just vitamin C by itself, I wouldn't say so. What I would say is, why not start to eat more fruits? Lemons and limes are awesome. So are things like oranges, not orange juice, but you can do all of that. Of course, if you have kidney stones, we would tell you got to reduce your vitamin C intake. How are muscles affected by strong antibiotics? It's interesting, because what ends up happening is when you start to affect the gut bacteria, those gut bacteria bind to receptors in your muscle. So in other words, you're reducing that, and it can take weeks or months until your gut bacteria recover. Let's see, a couple questions coming in on Instagram. What if a lot of vegetables give you gas? So the answer is very simple. When you start vegetables, what you got to understand is you got to go very, very slowly. Don't feel like it's all or nothing. I'm a bad person if, I'm still doing all the other stuff. No, start with some very basic. What do you like? What kind of vegetables can you eat? Is it just lettuce? If so, great. We applaud you for trying to make that change. You don't have to jump into things like beans or lentils, etc., right away. Take your time. Start with vegetables. What about fruit? If you like fruit, you can start with that. And then, in terms of digestive enzymes, you can certainly do that, especially in the beginning if it helps you. But usually, doing it slower and at the same time starting to cut out sugars. The more you're able to cut out sugars from your diet, it's a crazy thing, the better off you'll be. And don't forget, one of the best ways to damage your gut, one of the best ways to damage your gut is things like Splenda, stevia, monk fruit, erythritol, xylitol, NutraSweet. All those alternative sweeteners is what can really, really get you into trouble. And let's see, Boomer and Beyond Wellness said, hello. Wow, from, let's see, Lauderdale Lakes, Florida. That's so cool. Well, thanks so much for coming. I really appreciate it. And then let's see. I have bone on bone knee pain, osteoarthritis. What should I be eating for the inflammation and pain? This is very tricky, right? Because when you got bone on bone, and I can tell you, I have a lot of joint issues from my years of doing martial arts. I did taekwondo for 15 years. I've been doing jujitsu and I keep getting hurt in that. So lots of different sports and boxing and kickboxing and so forth and so on. But in terms of the stuff for inflammation, my supplement regimen is actually very basic. I take my B vitamins. I take my turmeric every day. I use turmeric because of the fact that the secondary benefits, especially on brain health, are awesome. It can also help you relax. It can help you sleep better. And that's why I use it. I do, things like algae-based omega-3s. That makes a difference. You can do fish oil. Just make sure it's concentrated because the act of concentrating gets rid of the heavy metals. So that's why it means that part. To the Glow Up NP, just remember when we talk about sugars, we are not talking about fruits. We're talking about added sugar. So I should have clarified. So great question as far as that goes. And then, yes, lentils, crafty as lentils are awesome. Let's see. Doma said, how do you get rid of H. pylori? Finished 2 courses of antibiotics with omeprazole, still got stomach pain. This is where if you've gone through 2 courses, we really need to figure out what's really happening and do we need to change the regimen. So you really want to talk to your doctor because putting you through another course will mean we would have to do an extended course to make sure that we get rid of it. Let's see. Crafty said, you never see an elephant deprived of bone structure, etc., and it eats vegetation. Think about it. What a great comment, right? You're absolutely correct in saying that. All right, the time is 5:40, and I know I got to run. I want to thank you guys so much for showing support. Listen, the greatest compliment you can ever give me is just to share this with your friends and just get the word out. And I always end the show by saying the same thing every time. And it's not because it's gimmicky. It's not because it's something there. I have 2 daughters. One is 7 and one is 11. And I know I get the joke 7-11 for a whole year. So I get that joke. But my daughters, one day, and sometimes they do watch it now, but one day they're going to look back and they're going to look at what their father did. And the biggest thing I want to teach them is they're monsters. They do jiu-jitsu and wrestling and they're amazing. But I tell them is if you grow up to be anything you want to be, grow up to be kind. Kindness in this world is something that's disappearing every single day. Listen, you can be anything you want to be, but if you can show kindness to somebody, it's the greatest gift you can give to others. And in return, it will lower your stress, lower your blood pressure, make you live longer. So if you want to be selfish, practice kindness. So that's my motto for you guys. Thank you so much. I'll see you guys next Wednesday, 5 p.m. Pacific Central Time. And as always, take care of yourself, take care of your loved ones. Nobody will care if you are the richest person in the coffin. They will care